where an abstract that was selected for the session, and you'll see it's very relevant. So the speaker is Catherin, and she's originally from Paris, but currently in Switzerland. And the title of her talk is Processed and Ultra-Processed Food and Risk of Inflammatory Bowel Disease in the European Perspective Investigation into Cancer and Nutrition Cohort for EPIC IBD. Catherin, we're looking forward to your talk.
Okay, thank you for this opportunity to present this study. As nicely explained before, there has been an incidence of IBD in industrialized countries in the 19th century and in industrializing countries in the 20th century. This suggests the role of environmental factors, among which dietary factors are suspected to play a prominent role. You can see here a brief and uncomprehensive summary of the associations that have been observed in large prospective cohorts on both sides of the Atlantic. Approximately 10 years ago, Carlos Montero and his team proposed the classification of food based on their processing. The NOVA classifies food items into 4 groups. Group 1, unprocessed or minimally processed food. Group 2, processed culinary ingredients, such as table sugar, oils, or salt. Group 3, processed foods, such as cheese, simple bread. And Group 4, ultra-processed foods, for instance, soft drinks, snacks, or processed meat. During the past decade, human diet has evolved towards higher intake of processed and ultra-processed foods. So we investigated the association between NOVA classification and risk of CV and UC in the EPIC cohort. The EPIC cohort is an ongoing European cohort that was established in 1991 to investigate the role of environmental factors in various cancer and chronic diseases. EPIC includes 10 European countries and roughly 500,000 participants. Participants were included prospectively between 1991 and 1998. EPIC IBD is a subgroup of EPIC cohort with 8 countries and roughly 400,000 participants. This slide illustrates the collection of data. For instance, in France, the cohort was established in 1990. Participants completed questionnaires approximately every 24 months. Dietary data was collected in the third questionnaire. There were specific questions about CV and UC occurrence in each questionnaire. IBD cases identified before the dietary questionnaire were considered as prevalent cases and were excluded. So dietary data were collected at baseline by using country-specific validated questionnaire, the food processing questionnaire. These enable to compute individual mean consumption of food or food groups. In this study, all EPIC food items were categorized prospectively according to the NOVA classification into groups 1, 2, 3, or 4. The transition of food processing over the past decade requires the use of different scenarios when classifying food according to the NOVA classification in a long-term follow-up cohort like EPIC. As you can see using the example of bread, white bread can be considered as processed or ultra-processed. So different scenarios were tested for estimating the dietary content of group 4. The most likely scenario named middle bound scenario, and the worst case scenario named upper bound scenario. With the latter considering processed food for which the degree of processing was unknown as UPF. For each participant, we calculated the proportion in grams per day of unprocessed minimally processed food, group 1, and UPF, group 4, in the total diet. Analysis were performed for CV and UC. We used Cox models to obtain Haber ratios. Linear trends were tested, and we had 2 models. With model 1, using the stratification by center, age at baseline and sex, and model 2, additional adjustment for smoking status, body mass index, physical activity, energy intake, educational level, and alcohol consumption. So we had more than 400,000 participants, about 180 cases of TB, and 400 cases of UC. Mean age of participants was 50, women representing 2/3 of the population. Participants were followed for nearly 12 years. The highest proportion of UC assessing in the United Kingdom with 19%, and the lowest in France with 7%. Participants with the highest intake of unprocessed minimally processed foods, NOVA group 1, were negatively associated with the risk of TB. There was no association between NOVA group 1 and UC risk. With the middle bound scenario, there was no association between NOVA group 4 and TB or UC risk. Within the upper bound scenario, there was a positive trend between NOVA group 4 and risk of TB in the age-adjusted model 1, with a p-trend of 0.03. There was no association between NOVA group 4 and risk of UC. All strengths are the mixed-sample prospective design and the validation of IBD cases. The limitations are the collection of dietary data at baseline, the mean age of participants of 60-year-old, and the limited number of cases. In summary, NOVA 1 is associated with a lower risk of TB. It seems that we have a positive trend between NOVA group 4 and risk of TB, and no association between the NOVA group and risk of TB. Thank you.
Thank you.